Hi, I'm Dr. Jennifer Creese. I'm a lecturer in Health Services Research at the University of Leicester. In this video, I'd like to briefly explain to you how a clinical academic career pathway works if you're interested in building yourself a career in medicine that also involves opportunities for research and innovation. A clinical academic career is one in which you share your time between clinical practice and research, teaching, and management. You get the opportunity to build expertise in an area that you're passionate about: safety, health inequalities, epidemiology, medical statistics, and more. And you craft yourself a career where you can combine this expertise with clinical knowledge and service delivery. You get to be part of not just developing innovative clinical practice in your specialty, but implementing and delivering innovations in your patient care and lead improvement on a national and even international scale. The process of developing an academic career is similar for many people, doctors and non-doctors. However, many of the steps towards academia can be done through recognized programs as part of your postgraduate medical training without having to pause your training program or work in your own time. Options are also available for doctors who are not in training programs. First, you need to develop some research experience and possibly undertake some research training, which you can do alongside clinical work and training. Then, you do a research doctorate, either a PhD or MD, which can often be taken while you're training. After this, you take on a clinical lectureship, and you can do this while you're finishing specialist training off. Finally, you might choose to become a consultant and apply for an NHS consultant post with a proportion of research time in the role specification. You can also have a joint appointment as an NHS doctor and a university associate professor. If you're wanting to get into a clinical academic career, the best first step is building up some research experience and a track record. Some training programs have an academic component, but if you're not on one of these, you can still build up your research skills and portfolio by writing up case reports, taking on side projects with more senior clinicians, and presenting at conferences. You can also get some formal qualifications in research skills, like undertaking a master's degree in research or an MSc, where you get to undertake a piece of research like a dissertation. You should also investigate what sort of PhD project you'd like to do. Either design your own project for a fellowship or look into the sorts of projects and topics that established PhD programs are offering. There are special schemes on offer through Health Education in England and other partners that can support you to start your academic career as part of your training if you're a training doctor. In foundation year, doctors can apply for Specialist Foundation Program, which gives them 2 years with research training and time built in. Academic clinical fellowships, which you can apply for once you're in specialist training, are offered through Health Education England, partnering with local universities. These training posts include 25% dedicated research time, master's level research training, and the opportunity to develop a PhD project for a doctoral fellowship and complete work for publication. Doctoral clinical fellowships are also available for those in specialist training, which fund the candidate's PhD costs and salary and allow 80% dedicated research time to complete their studies. Once your PhD is done, you can continue working on research and implementation arising for your project right up to the time you receive your CCT under a clinical lectureship at a university. You should note that not all of these steps are necessary, apart from the PhD or MD, which are applied for clinical lectureship or honorary professor appointment. Many of these opportunities are also available if you're not on a training program. If the clinical academic track sounds like something you're interested in, you can start by talking to your clinical supervisor, your education supervisor, or your DME, and let them know you're keen on research and put your hand up for any opportunities. You can speak to the Academic Clinical Fellowship Coordinator for your deanery about programs and opportunities in the local area, or you can contact the Director for Clinical Academic Training at the university which you're interested in. You should look at the various funders that support clinical doctoral fellowships, including the National Institute for Health and Care Research and the Wellcome Trust, to see what schemes and projects are available and what you need to do. You can also look at online PhD advertising boards like findaphd.com, but do beware that not all PhD studentships pay the NHS salary and pension, and not all will allow part-time study to allow you to maintain your training or career development. To find out more, I recommend taking a look at the Clinical Academic and Training Careers Hub online and the National Institute for Health and Care Research website for opportunities for doctors and dentists. You can also look at the University of Leicester's special website dedicated to clinical academic opportunities and contact the team if you have any questions. I hope this video has been helpful. Good luck with your career development.